feel any pain or discomfort throughout the exam, please let me know. Do you have any questions or concerns?
No.
Okay, I'll be right back. I'm just gonna go wash my hands. Wash my hands for 60 seconds. I'm gonna apply my gloves on. Okay. All right. Before I begin, can you confirm your name, date of birth?
Joel Gonzalez, November 7, 1990.
Okay. Do you know where you're at?
Doctor's office.
Do you know what year it is
2019.
and why you're here?
Sick.
Okay. Alert and orientated ×4. General survey. Patient has erect posture, relaxed position, clean and well groomed, good hygiene. Patient appears well nourished and dressed appropriate for season. Okay, I'm gonna go ahead and begin by inspecting your head. Do you have any tenderness?
No.
Okay. Normal cephalic. Normal cephalic, normal hair distribution, and no foreign bodies are present. Okay, I'm gonna go ahead and assess your cranial nerves. Can you close your eyes and smell this? Can you describe the smell? Okay, wonderful. Cranial nerve number 1 is intact. To assess cranial number 2, I'd have patient stand up, 20 feet away from the Stellan chart, cover one eye at a time. Visual acuity 20/20 on right and left eye. I would also dim the lights with my ophthalmoscope. I'm gonna shine this light over your eye. Red reflex is present. Okay, turn the lights back on. All right, now I'm gonna assess for 6 cardinal fields of gaze. Can you follow the tip of my pen without rotating your head? Okay. All right, I'm gonna shine some more light into your eyes. Okay. Pupils equal round reactive to light. Pupils are reactive to direct and consensus light. All right. Pupils are relaxed at 3 millimeters, constricted at 2 millimeters. Okay. Cranial nerves 3, 4, and 6 are intact. All right. Can you let me know if it's soft or sharp?
Sharp. Soft. Soft. Sharp.
Okay. Can you raise your eyebrows? All right. Can you smile? Can you frown? Can you blow air into your cheeks? Okay. Can you clench your jaw? Okay. Cranial nerves 5 and 7 are intact. Now I'm gonna measure with Weber test for conductivity. Do you feel vibration on both sides?
Yes.
Okay. Cranial nerve number 8 is intact. Okay. Now I'm gonna inspect the mouth. Can you stick your tongue out? Okay, can you move your tongue side to side, up and down? Okay, can you take a sip of this? What's it taste like?
Nothing. Water.
Okay, cranial nerves 9, 10, and 12 are intact. Can you shrug your shoulders? Can you move your right ear to your shoulder? Your left ear to your left shoulder? Can you bring your chin to your chest? Can you bring your head forward, up and back? Can you look straight? Okay, cranial nerve 11 is intact. Range of motion is within normal limits. Okay, that concludes my cranial nerves. Now I'm going to go ahead and palpate for any swollen lymph nodes, submental, non-palpable, submandibular, non-palpable. Okay, preauricular, non-palpable, postauricular, non-palpable. Okay, anterior cervical, non-palpable, posterior cervical, non-palpable. Supraclavicular, right here. Supraclavicular, non-palpable. Okay, can you extend your arms? Talar spectus, non-palpable. Thyroid is non-palpable, non-tender, and then the trachea is midline. Okay, that concludes our lymph nodes. All right. Can you go ahead and extend your arms out front? Okay. Skin is warm, dry, and intact. Alright. Cavity refills less than 3 seconds. Gonna measure skin turgor. No tenting. Okay. Go ahead. Uncross your feet. I'm gonna measure for capillary refill. Okay, less than 3 seconds. I'm gonna inspect the legs. Okay, no varicosities and no edema noted. Okay. Now I'm gonna go ahead and palpate the artery. The pulses. Temporal is equal in strength. Bilateral plus 2 regular. I'm gonna palpate the carotid artery one at a time. Carotid artery is equal in strength. Bilateral plus 2 regular. I'm gonna auscultate the carotid artery with the bell of my stethoscope. Okay, turn your head to the side. Okay, turn your head to the other side. Okay. No bruise auscultated. Okay. Now I'm gonna go ahead and palpate. You can put that right there. Brachial artery is equal in strength. Bilateral plus 2 regular. Okay. Radial is equal in strength. Bilateral plus 2 regular. Ulnar is equal in strength. Bilateral plus 2 regular. Palpate 2 one at a time. Equal in strength. We'll see actually. Equal in strength. Bilateral plus 2 regular. Dorsal pedis. Equal in strength. Bilateral 2 plus regular. Posterior tibialis. Equal in strength. Equal in strength. Bilateral plus 2 regular. Femoral. Equal in strength. Bilateral plus 2 regular. Okay, that concludes all your pulses on your body. Alrighty, now I'm going to go ahead and inspect the chest. If he was a female, I would palpate the breast for any abnormal masses. Breasts are symmetrical, everted nipple, no discharge. Okay. Also, I will educate the patient to examine her breast 7 days after her menstrual cycle for any abnormal findings, masses. Okay. I'm going to continue to inspect the chest. No thrills or heaves noted. Take a deep breath. Okay. No thrills or heaves noted. Symmetrical and equal chest expansion. Effortless respirations. Okay. Ratio of chest is 1 to 2. No barreling of chest. Now I'm going to go ahead and auscultate the chest for the heart with the bell of my stethoscope. Aortic S1 and S2 noted, center intercostal space. Pulmonic S1, S2 noted, second intercostal space. Herbs point S1 and S2 noted, third intercostal space. Tricuspid S1 and S2 noted, fourth intercostal space. Mitral S1 and S2 noted, fifth and sixth intercostal space, also known as the point of maximum impulse at the midclavicular line. I would never auscultate over the shirt. It would be over on the skin. If the patient has hair over them, you would moisten the end of your stethoscope. Okay. Now I'm gonna go ahead. S3 and S4 not present. No murmurs, no bruise, no thrills present. Okay. Now I'm gonna go ahead and auscultate the lungs with the diaphragm of my stethoscope. All right, take a deep breath for me. Take a deep breath for me. Take a deep breath. Take a deep breath. Thank you. Clear and normal vestibular breath sounds. No adventitious sounds. In the anterior lungs. Now I'm going to go to the back. If you can turn all the way for me. Okay. Take a deep breath every time I slide my stethoscope. Okay, normal lung sounds, no adventitious lung sounds. All right, now I'm gonna go ahead and percuss. percussion, no spinal tenderness. Now excursion. Take a deep breath. Alright. Expansion is symmetrical with respirations. Alright, now if you can turn this way. Alright, and lay down. Alright, knees are elevated. Before I inspect your abdomen, when was your last bowel movement?
3 hours ago.
Okay, and can you tell me what it looked like? Was it solid
Solid
and brown? Okay, and when did you last urinate?
3 hours ago.
Was it yellow? Was it clear?
It's pretty yellow.
Okay, and can you tell me about what your appetite's like?
I haven't really been hungry.
You haven't been very hungry? Okay. And when was your last meal?
5 hours ago.
Okay. Alrighty, if you feel any discomfort or pain, please let me know. I'm gonna go ahead and raise your shirt. Alright, I'm gonna inspect. Contour is symmetric, equal on both sides. No protrusions, distensions, no visible masses. Umbilicus is inverted upon inspection. Now I'm gonna go ahead and auscultate the abdomen with the diaphragm of my stethoscope. Already no more active bowel sounds in all 4 quadrants upon auscultation. Appendix is in the bottom right lower quadrant, and the liver is on the top right lower upper quadrant. Already. Now I'm going to go ahead and light palpate. Do you feel any pain?
No.
Okay. No palpable masses or protrusions. Okay, now deep palpate. Did you feel any pain when I released my hand away from you? Okay, no rebound tenderness upon deep palpation. Now I'm going to go ahead and percuss. Okay, tympani predominant in all 4 quadrants upon percussion. Okay, thank you so much. Alright, can you bring your knee to your chest? Can you bring your other knee to your chest? Okay. Can you abduct and adduct, abduct and adduct? Alright. Okay. Range of motion within normal limits. Alright. Can you rotate your ankles in like a pizza, out like a pizza, inversion, eversion, range of motion within normal limits. Can you push your feet down against my hands, okay. Plantar flexion, dorsiflexion within normal limits, okay. Can you push against my hand? Can you push against my hand? Push against my hand. Push against my hand. Okay. Alright. Abduction and adduction strength is 5 out of 5, as well as plantar flexion and dorsiflexion is 5 out of 5. Okay. Can you slide up a little bit? Alrighty. Now I'm gonna measure the Babinski reflex from the bottom of the heel up the pinky across the toe. Okay. Babinski reflex is negative. Go ahead and sit up for me. Turn to the side. Alrighty. Can you hold my fingers as hard as you can? Can you press down? Can you press up? Upper extremity strength is 5 out of 5. Can you also do this up to the sides? Move your hands to the sides. Up, down. 5 out of 5 in strength. Already, the reflex, I will use my reflex hammer. Okay. Tricep reflex, 2 out of 4. Bicep reflex, 2 out of 4. Brachioradialis, 2 out of 4. Tricep reflex, 2 out of 4. Bicep, 2 out of 4. Brachioradialis, 2 out of 4. sit back, have your legs dangling. Patellar reflex 2 out of 4. Patellar reflex 2 out of 4. Gluteus reflex 2 out of 4. Gluteus reflex 2 out of 4. Okay, that concludes all the reflexes and the range of motions. Can you go ahead and stand up? Walk 3 steps forward, 3 steps back. Can you close your eyes and bring your index finger as fast as you can to your nose? Do it again with your other hand. Okay, while your eyes are closed, hands off to the side, can you touch on your fingers? Okay, gait and balance is normal, rapid finger movement is normal. Okay, go ahead and sit down. At this point of the examination, I would inspect the male genitals. I would inspect the shaft and the glands of the penis for any abnormal masses, any protrusions, the meatus with no discharge. I would palpate the scrotum for any palpable masses. I would educate the patient same day out of every month in the shower to palpate for any masses. If it was a female, I would inspect external genitalia. I would inspect the labia, the clitoris, the urethral orifice to make sure there's no masses. Then I would also go inside the vagina and check the cervix if it's pink, and then if the oral mucosa is pink, and if there's any discharge. For female and male, I would inspect the anus for any hemorrhages, hemorrhoids, any protrusions, or anything that looks abnormal. I would insert my fingers and check for any prostate enlargement. And that concludes the assessment. Do you have any questions or concerns?
No.
Okay, great job. Thank you so much. And I'm gonna go wash my hands.